Welcome to Rewriting Midlife. When you're looking for podcast guests, sometimes you don't need to look any further than your own kitchen. And I'm super excited today because as I was thinking about my next guest for the podcast, I realized that my husband is a perfect guest for the concept behind this, which is that you can change the narrative in the second half of your life. You don't have to just go along with what everyone else says you should do. So I want to introduce you to my very handsome husband, Dr. Ian McLeod. He's a board certified otolaryngologist. He is the father of our 4 children and our soon to be 3 grandchildren. And I want to just interview him about his story of being a doctor and some of the different choices that he's made, particularly recently, that have kind of redefined his life. So, Ian, welcome to the show.
Thank you. Thank you for having me.
I know you said this isn't like your comfort zone, but I'm really glad that you're willing to be uncomfortable to do this for me and for everyone else who's going to listen.
Yeah, this is way out of my comfort zone, but we'll roll with it.
You'd rather be in your garden. I know you'd rather be outside.
Outside.
Yeah, anywhere outside. Okay, so we're going to go back, and I want you to tell us the story of when you decided to become a doctor and what kind of work, school, training went into that.
Oh boy. Well, I knew I wanted to be a doctor in the 8th grade. That's when I decided. I did a career fair project. I had to do a career fair project, and it was on physicians because I figured that was a good job. It allowed me to take care of people. I had a heart to help people, and I knew it would be a long road, but I delved into it by interviewing a physician who really discouraged me from becoming a physician. Which
Wow, he said, "Don't do it."
He said, this is a very tough lifestyle, and
Do you remember what kind of doctor he was?
he was a urologist. Yeah. So he did everything in his miserable demeanor to discourage me.
I forgot this story.
Yeah, but I don't know, something inside me, maybe that challenged me to want it more. I don't know, but yeah, it's a long road. It definitely is.
And you had to go through how many years of school?
Well, 26 years. I think you wrote a song about it.
I probably did.
Yeah, 26 years of formal education. And then, yeah, my residency was 4 years. And then internship, you include that as well. That's a year.
Right.
And
so it was college. It was 4 years of college, 4 years of medical school, a year of internship, and then for you, 4 years of residency.
Right.
So by the time you got out and you were actually acting as an attending full-fledged doctor, you were what? You were like in your 30s, right? I feel like you were in your early 30s by the time you got out.
Probably.
Yeah. So you decided to go into ENT, which a lot of people, at least I didn't know that ENT was a surgical subspecialty. For some reason, I just thought, oh, well, ENTs like help people with sinus problems. But actually, tell us a little about what ENTs do, what's kind of their scope of practice, and why you decided to do that.
I mean, I decided to go into ENT. That's always the biggest decision when you're in medical school. What type of physician am I going to be? But there were a couple things that played into that. One was I knew I wanted to be a surgeon. And then the second thing was I wanted to see all types of patients, adults and children, all ranges. And I also wanted to have a good lifestyle. That was important. General surgeons tend to have a very busy, demanding lifestyle with trauma surgery and whatnot. Emergency calls in the night. Not that ENTs don't, but it's not necessarily to the same degree. And I knew the type of surgery I wanted was kind of more hands-on, delicate surgery as opposed to like body shop, like orthopedics.
So you call it orthopedics like body shop, like it's like basically like they've got saws and hammers, and it's
Yeah,
just,
saws, hammers, drills.
and that didn't appeal to you.
Uh, no, I'm more of a intricate, fine kind of type style, and the technology in ENT, that was the other thing. The very cool technology and equipment was coming out when I was about to enter residency, and
You're
so
talking about like the
that turned
robots
me on.
assisted surgery and things.
Well, that came a little later, but it was the scopes, the working under a microscope too, and being able to look down into someone's voice box, their
I
larynx.
didn't realize that was a new technology when you were.
Yeah, I mean it
So
wasn't
they were
new
improving it.
necessarily, but yeah, the technology was improving.
Gotcha.
Yeah,
So
from mirrors,
I
we
know you,
used to use mirrors.
but tell me a little bit more about some of the other gifts that you had that maybe played into the fact that you liked more detailed surgery, because you have
Uh,
quite an artistic gift.
right, yeah, that's my spiritual gifting is art. So, um, yeah, my art I think played a role because I like to work with my hands, and I like to create, and I like to make things of beauty. So
Yeah.
yeah.
Tell me what residency was like. I know there's a lot of TV shows. We see, a lot of medical shows. I remember we watched ER, back in the day when it first came out. And you were like, this isn't how it happens. You
Yeah.
don't just go in and talk to your attending like that. You love to pick those apart. But tell us what it was like for you as a resident. I know the laws had kind of changed around the time that you became one.
Hmm. Yeah, I mean it's definitely not the drama of a TV show, but it's definitely demanding. Yeah, so my residency occurred kind of right as we were starting to shift into the 80-hour work week. That didn't come towards the end of my residency, but so when I first started, especially like with internship and my first and second year of residency, um, I was working 100 to 120-hour weeks.
Which,
Pretty.
in order to get that many hours, you really have to. You're spending the night. I mean, you would spend the night at the hospital every third
Every
night.
third night
Yeah.
we had call, in-house call.
So it was. I remember you lost weight. You were very stressed out. I
Yeah.
remember you coming home sometimes at 9 or 10 or 11, and then you'd have to get up at 3:30 to go back in, even after you had been maybe working, 2 straight days. So I know it was incredibly exhausting. And for me, being home with 3 kids, it felt like being a single mom. I just remember thinking, I had no backup. We didn't have family nearby. And so, if there was a doctor's appointment, it was me and me. So it was a lot of stress. I remember there were nights that we both cried because we were both so burnt out, like you
Yeah.
from your schedule, me from having no relief. So it was a tough time, a very tough time.
Yeah. I mean, and there was one point where I was going to quit.
That's right.
Yeah. Yeah. Almost gave up.
You actually wrote a letter of resignation
Hmm.
to the residency program. I just remembered this. And there was a doctor there. He was just an ENT surgeon. His name was Eric Mayer. And he literally came over to our house and he sat me down because he knew that I was struggling. I did not want this lifestyle for 4 years. This was the beginning of residency.
Yeah.
And he sat me down and he said, Rebecca, he said, listen, I've seen a lot of residents come through this program. I've seen a lot of young doctors. He said, but I really haven't seen very many with the gift that Ian has. He has a gift in his hands. And I know this is really hard, but it won't last forever. And I promise you, it'll be worth it in the end. And so after,
He was
yeah,
a great source of encouragement.
he was a great source of encouragement. He kind of like did an intervention for us, came over to our house, talked us both off the ledge.
Yeah.
And
What staff?
And I
Position
remember
does that these days?
I wanted you to go into family practice. I thought, well, that'll be a much easier life. But then all those guys got deployed because you were at Army. That's one thing we didn't talk about. You were training in the military. So
Right.
probably should back up and say you went to medical school through the Uniformed Services University, where they basically pay your entire medical school tuition. And in return, you serve 7 years post residency.
Hmm.
Actually, post medical school, but then you did residency and then it extended your time.
Yeah.
So, yeah. So, I was like, you should do family practice. But then those guys all got deployed constantly. So they were gone.
Yeah.
So we were fortunate in the sense that, yeah, you were busy all the time, but you weren't in another country, far away from home. We talked about the stress of residency. What about the stresses of just being a doctor? Like, what's it like knowing that you have patients' lives in your hands day in and day out?
Stressful. Yeah,
But you told me when we were talking about these questions, like, you can't think of it that, like you said, it's really, you
yeah,
can't
you can't think of it
think
that
about it
way.
like that.
And we really don't. I mean, you know, you have to put that aside, even though in some situations that's certainly a reality. As physicians, we're trained to deal with those things. So, um, you know, they tell you, the first thing you do at a code is you check your own pulse, right? I mean,
I never heard that.
so
See, I'm learning things that I've never heard before. 33 years of
yeah,
marriage.
you can't panic. You can't, you know, although you start thinking about what can go wrong, and then next thing you know, things go wrong. So,
So tell us one of the scariest things that's ever happened to you in the operating room.
well, it wasn't really in the operating room. This was in my training, actually. And there was a patient in the ICU that had just undergone head and neck surgery, and they had cancer, head and neck cancer, and had radiation, I believe, and other treatments. And this was a surgery that was done to try to eradicate the cancer. And they were trying to recover in the ICU, and there's something called a carotid blowout that can occur. And so this particular patient, I was down in the clinic, in the office, but was on call and got the call that our patient was bleeding profusely from their neck. Not just a little, trickle. This
They
was,
call it a blowout for a reason, right?
yeah, it's a blowout. And the carotid artery is the largest, second largest artery in the body next to the aorta. You have
You don't
some
want
big
that one to blow out
vessels.
either. Yeah.
Right. But this is one that, yeah, a tremendous amount of pressure and blood, and so I had to respond to that.
And you were fresh and you were pretty young in the residency.
Yeah, I think it was my first year of residency.
Wow.
Yeah.
So did you feel prepared for that, or you just kind of had to like muddle your way through?
Well, I mean, I knew direct pressure, right?
Right.
And so when I saw what was going on, it wasn't just me responding. There were
Right.
other people there, but I told them to call the staff immediately, and I plugged the bleeding with my finger and kept it on the carotid artery to dampen the bleeding. And then I remember the staff arriving, and then we literally took the patient right to the OR. And he looked at me and said, "Ian, you're coming with us. Don't move your finger. Everything's going to be okay." So
Was it okay?
It was okay. Yeah, we saved that patient's life. Yeah.
Okay, so now tell us about one of your favorite patients you've been able to treat.
Oh goodness, that's tough. I mean, I've treated hundreds and thousands of patients, probably. I mean, every, I enjoy treating all my patients. Everybody has their own, our own relationship. It's not always the same with everybody because everybody's different. But favorite patient, I don't like picking favorites.
There was a little girl that wrote
Yeah,
you multiple letters and cards.
and her mom still keeps in touch with me to this day. Yeah.
You also had a military musician who, there's been several patients that have like checked in with you every year to let you know that they're doing okay.
Yeah, that was a patient with melanoma that we treated, and he's been disease free. There was another gentleman with head and neck cancer that used to keep in touch for many years after his surgery. I've treated dignitaries.
Supreme Court Justice Rehnquist. That was amazing.
Yeah, I guess we can reveal that now.
Yeah,
He's
he's
gone.
passed on.
Yeah.
He was in his 90s when you treated him, wasn't he? He was,
Yeah. Very,
but sharp.
very sharp as a tack. The most brilliant mind, honestly, that I've encountered. Very, very smart man. Um, yeah. Yeah. So it was a great career. Military medicine was. Yeah. Got to see and do a lot. Treat a lot of soldiers from the Iraq War.
Yeah, and you were at Walter Reed during 9/11.
Yes.
And so you actually saw some of those patients coming in from the Pentagon, which was terrifying. I
Yeah.
remember I was home, and when the towers fell, I was home with Andrew, who's a baby, and I could not get you on the phone because the phone lines were immediately just blocked.
Yeah.
But I think you stayed overnight that night because they were bringing in patients from the Pentagon.
I stayed there for 3 days.
Oh, that's right. See, I blocked it out.
Yeah. Couldn't leave. We were on
It was
lockdown.
it was a very scary time. Very scary time. So, we know the stress of doctoring is high. 50% of doctors globally experience burnout. 300 to 400 doctors commit suicide each year, which is about one doctor per day. And I was researching this. It said the contributing factors include the high stress and workload, burnout and depression, access to lethal means and medical knowledge, and the stigma around seeking mental health care for doctors is real.
Mm.
So, have you ever experienced depression due to work stress? And can you tell us a little bit about it?
Yeah, absolutely. I think there were 2 periods of time during my career where I had some depression that I struggled with. One was uh, we were in the middle of just having. Well, no, we did move because of it. Yeah,
Mm-hmm.
I thought maybe the move was first, but um, I had just finished residency and became staff and stayed in the Washington D.C. area. And then I had my boards coming up because you don't take your boards right away after residency; you take them the following year. And so I was trying to prepare for boards, which is a very stressful event in a physician's life because if you don't pass, you've done all that training for nothing.
And you can't practice.
You can't practice,
It's
no.
crazy.
But you get to take it again. You can't take it up to 3 times, but who wants to do that? So anyhow, a lot of stress. And I was trying to prepare for boards, but also do this horrendous commute from Germantown, Maryland to Fort Belvoir. And even though I think it was within the radius of, what we were supposed to live as far as mileage goes, maybe, I don't know, 30 miles, 25, 30 miles.
I don't know, but if any of you know the DC area, there's this area called the Mixing Bowl.
Yeah.
We called it the toilet bowl because it was it's where 270 and 95 merge. And it's just always, DC traffic is just, it's horrible. But
I would hit literally 3 different traffic jams on the way.
Yeah.
home.
So, it was like sometimes it was taking you up to 3 hours sometimes to get home.
Yeah.
After a long day. And after 26 years of schooling and you're done now and you're out.
Right.
This is supposed to be.
I had reached
the goal.
my goal. And it was like my life just didn't reflect it. I was like having grueling hours. I was starting a practice, and being on my own and independent. And that has its own stresses with it. And I was the only ENT at this particular place. And again, then I'm trying to deal with studying and commuting 2.5 hours, sometimes 3 hours. Anyhow, so yeah, all that stress built up and it manifested as depression and even anxiety.
Did you want to quit?
I don't think I talked about quitting at the time. Maybe I did. I'm sure I had thoughts of it.
Yeah.
Yeah. You just kind of, when you get into depression like that, I'm sure people who have dealt with depression know that your mind just gets very clouded and you can't think straight, and which makes things worse.
Yeah.
And it becomes this bad spiral. So
how did you overcome the depression?
I got on medication. Yeah.
Was that difficult for you as a physician?
No. We kind of are taught that, there are medicines to help things, obviously. So I see depression as just another type of illness or disease process that, um, you know, needs medication from time to time.
But in the military and for a lot of soldiers, they don't want to pursue that because they feel like it's going to go on their record and it's going to
Yeah.
tar their record in some way, having had that bout with mental illness. Um, but that you feel like that wasn't something that worried you.
No, I think the military's gotten away from that stigma because they were realizing that yeah, people weren't getting the help they needed,
Yeah,
and
and a lot of suicide probably wasn't
suicide
prevented because of
was
it.
happening, and
Mm.
yeah,
Thanks so much for sharing that. I know that's not easy to talk about.
yeah.
So the narrative for most doctors is that your patients always come first. You work until you drop, or you work till you physically can't work anymore. When did you decide to change that narrative for yourself?
Uh, well, I mean, when you enter into that profession, the profession of being a physician, you you really you see it as a career. It's long term. It's something you're going to do, forever. And that's kind of who you are. Your identity gets very wrapped up in it, and but it also becomes this vicious cycle and trap for a lot of people. I think. So I had to come to a realization that for me, it wasn't something that I wanted to do long term. It was more of a means to an end, and it took me a while to figure that out. I just had to be honest with myself, because again, you go through all that time and effort, and yeah, you want to be able to do it forever, and some people can. Some people, truly, they get life and vitality out of their careers. Maybe that comes at some point later down the road. I mean, I'm 55, but I've been doing this for what, 25 years, and it hasn't come yet. And
Well, I remember you started listening to there was a physician on fire. It was he did a podcast. He had some books, and I remember he really inspired you to. I mean, you've always been big on saving money and investing.
mhm,
It's always been a
yeah,
passion of yours, something that your dad and your brother both kind of got into as well. Um, but this physician on fire was about sort of like working towards financial independence. So
mhm.
you mentioned a trap. Can you explain a little bit more about what you think the trap is that a lot of physicians fall into financially?
Yeah. I think the perception is that physicians must be financially sound and have this huge savings account because they make a lot of money, and that's actually not true. I think there's certainly more physicians that don't save; they spend, and they spend on a lifestyle that they've come to know and enjoy, and um, it's again, I'm not knocking anything or anyone. It's just that
It's a choice.
it's a choice.
But to you, it's a trap because in a sense, it's like you start feeding this big lifestyle, and
You
now you
feed the
can't
lifestyle, and then you can't
do anything else.
decide to retire. It's like, okay, well, what about when I'm not working, or what about if something happens to me? If I die, or I know there's insurance and all that, but I all these things went through my head. It's like I want to enjoy you know life now, and when I say life, I mean relationships now, not necessarily spending a bunch of money, having a boat, or having a second house, and stuff like that. I guess what I'm saying is my time became more important to me because um, I neglected a lot of relationships in my life, my family in particular, during my training and for a lot of my career. So um, I was tired of that and wanted a way out. And the way out for me was to save wisely. The material things didn't matter as much to me, so I could be happy with you know, with what we have and content and, you know, I just wanted security, knowing that, yeah, we'd have, you know, enough money to live a lifestyle that, you know, would be good for us, but not extravagant.
So I'm going to push you a little bit here, and you know, because I love you, and because I think this point has a lot of relevance for a lot of men that might be listening to this. You touched on the fact that because of your career, because of your work, because your identity was wrapped up in being a doctor, um, which I think is so common for men and for a lot of women. It's not just men, but a lot of us find identity in what we do. And you said because of that, a lot of your relationships suffered. Um, like if there's a man out there who's feeling the same thing, like, yeah, I feel this pressure to provide for my family, but at the same time, I feel like I'm just not at all connected with my kids. My marriage is on the rocks, which you and I certainly have gone through those periods.
Yeah.
How do you like draw a line in the sand and say enough? I mean, how do you make that decision? Because, you know, it sounds all great and easy the way you're saying it, but like, it's really not. It's really
No,
not easy
it's
for
not.
men to prioritize relationships sometimes when, especially when there's a big paycheck involved.
Yeah.
And I remember, I remember that because you mentioned the first depression, but the second depression, you were really, really burnt out. It was when we moved to Savannah in 2015.
Mm-hmm.
And I remember you saying, I just want to be a park ranger. And I was like, honey, you are at the top of your earning potential. Okay. There is no park ranger right now. This is not, you know, and that, you know, even for me as his wife, it's like, and he knew it, you knew it. I remember you saying, this is like, I'm at the point in my life where I can make them, you were like, you know, late 40s.
Mm-hmm.
And you were like, I want to be a park. I mean, you were burnt. You were fried.
Yeah. Peak earning potential.
Yeah. Peak earning potential. Wanting to be a
But
park
yeah,
ranger.
I was experiencing physician burnout at that point. I was also transitioning out of the military. I'd put 24 years in the military, and perhaps maybe got a little institutionalized, and there were some fears about, you know, what next in private practice, and, you know, starting that, getting on a whole nother train, so to speak. But yeah, that was another depression I faced at that point. And
But talk about your relationship with the kids and how the demands of your job kind of fed into that.
mm-hmm. Yeah, I mean, as men, we're I don't know if we're taught it or it's instinctual, but we're providers, and we provide security and protection for our families, and so again, you know, it's a difficult thing when you have the demands of work, yet you also have to, you know, be involved emotionally in your family.
And the truth is, a lot of times you came home and you just didn't have anything left.
And I couldn't, and there are certainly dads out there I know that do it, and they do it remarkably well. And, and, and I applaud men like that who can do that and almost, you know, balance that. It's a tough balancing act for a lot of guys like me, especially. I'm a very logical thinker and very, I don't want to say black and white, but, yeah, I mean, as physicians, you know, most surgeons are type A, and that's just our personalities. So it's difficult to separate work and play or emotions. Not that we don't have fun, but it's this difficult balance because, yeah, it just took me a while to figure out, you know, what was important to me. And yes, my job and my career was important, but I had terrible work-life balance. I did not know how to achieve that while in it, until recently, you know, and for me, it was getting out of private practice, throttling back my work hours significantly. I'd even tried that prior to leaving private practice, and you know, I decreased my schedule from full time to, you know, a 4-day work week, and then a 3.5-day work week, and that was good, and it helped, and it allowed me to continue, you know, private practice for several years. But there was still call, there was still responding to emergencies in the middle of the night, there was still having to plan vacations around call. And so I really couldn't, break away. There's always this underlying stress of having to respond in the middle of the night to an emergency, and
Mm-hmm.
anyhow. So yeah, I ended up leaving private practice and then doing something called locum tenens, and for me, that made all the difference in the world.
And that was just 2 years ago that you made that switch.
Three.
Has it been 3?
Yeah, this is the third year. This is my third year.
Right. You started at the end of 2023.
Yeah, I'm in the middle of my third year.
Or maybe, I don't know, 2024. I don't know. Anyway,
Yeah.
so so you fought for the 4-day work week, and you found when you ran a study when you were still in the military,
Mm-hmm.
and you found that you were actually the people were more efficient with a shorter work week, longer days than they were doing the 5 days.
Yeah.
I think a lot of people have moved to that, like even in the corporate world. Like I think about our kids, Andrew and Ann are doing that 4-day thing.
Yeah.
But you still feel like, and I remember, I mean, it's amazing. I think about how like you could go from a dead sleep to like, a dead sleep, absolute dead sleep to, hi, this is Dr. McLeod, which, and then just like going into like what they needed to do, listening to their problems. And I'd be like, how in the world does he do that? Like most people need a minute to like think. But it was amazing how you could just take a call and go from a dead sleep to dealing with, and sometimes the problems were like really small and super irritating, but sometimes they were not. They were things that you had to admit somebody for, had to get dressed and go in the middle of the night. So it is the demands are real, and the toll that it takes is real too over time. So okay, so your work is your work. When you say work life balance, like you have a really good work life balance, because right now you work. How often do you work?
I work 1 week a month. It's not even a week. It's 5 work days and 2 half days of travel. So, it's been incredible because after that work week, I'm home and I have no other work demands or responsibilities. I don't take call in this particular job, and I don't get bombarded when I'm at home and off. So yeah, maybe now I'm out of maybe I'm too much time off. No, I don't think so. I don't think you can have too much time off.
I was gonna say, so now that you have these 3 weeks, and again, this is a huge shift. Oh, I just want to ask you, when you tell other doctors about your life right now, like let's say you run into somebody that you worked with before, what is the most common response that you get?
They're like, wow. I think they're shocked that number one, you can actually do that, or they've heard it and they've been wanting to do it and they just don't know how or when to pull the trigger. And there may be some jealousy possibly. Yeah. They're just like, oh.
Because either they feel like you said they're in a lifestyle they can't reduce, or don't want to, or they just don't see a way out of the whole grind of caring for patients. They've established their practice. These people rely on them.
Yeah.
Thinking of one particular doctor who like literally never takes a vacation because he's like, I don't trust anyone else with my patients.
Yeah.
And I'm like, wow, that's really a shame for your family that you live that way. But it's a reality for a lot of doctors.
It is. Yeah.
So when you're not at work, what are some of the other things that you do now?
Whatever I want. I follow my nose. I mean, it's great. I'm getting to do a lot of the things that I put on the back burner, like my art. I love being outside and gardening and just being in the yard.
This man can resurrect plants from the dead.
Filling my hands in the dirt and just just beautifying. I think my heart is to beautify things and to be responsible and take care of the things that we have. Again, the tendency is to want to get more and more and more and more, and it becomes nearly impossible to maintain, all these things that you have, or requires other people to help you maintain them. And I, I try to operate from a mindset of I lack nothing. Um, everything I see and have is mine, and I take care of that. So I like being outside. I like nature. I like going on hikes. I like
I have something hidden under here that I'm trying to
working
get.
out, going to the gym.
All right, so Ian just finished his painting yesterday, and I have to brag on him.
Why,
He didn't even know that I brought this up here, but
why
I'm going
did
to
you
bring it a
bring
little
that
closer
out?
so you can see. But he just finished this yesterday, so you can just see the incredible artistic skill that this man has. I'm so proud of him, and I just think this tiger is incredibly beautiful. So
Right.
I had to show that.
Okay, they'll need to edit that out.
No, Cicely, don't edit it out.
Edit it out, Cicely.
Leave it in. Leave it in.
Yeah.
Okay, so we can't stop. We can't end this podcast without telling you two of my favorite doctor stories. When we have dinner parties, if you've had a dinner party with us enough times, you've heard these stories. But I make Ian tell them anyway because they're my favorite stories.
I'm scared which stories you're gonna choose.
He's going to do great because he always does. So my favorite heartwarming story has to do with an encounter with a young man. Ian was working at Baltimore Shock Trauma. He was doing a rotation there. I don't remember what year it was. Maybe you do.
It was my 4th year of residency.
Okay. So maybe 2005, 2006.
Yeah.
And
2004 or 5.
This young man had been in a car accident, and every bone in his face, his face was just shattered. And Ian, do you want me to tell the story? You tell the story. I don't like to tell it, but you tell it.
You tell it better, honestly.
No, you need to tell
I
it.
remember different aspects of it, but yeah, I mean, that was a busy hospital for sure, but we get lots of trauma, obviously, implied from the name. But this particular man was in a very, very bad head-on collision motor vehicle accident on an interstate. And he was literally a mess. His face had hit the steering wheel, and it shattered his entire face, basically. And we're on trauma call, so we were the ones to take care of him. And so, we had to secure his airway. He got trached, and then he underwent a series of multiple surgeries after that.
But as he was on the gurney coming into the hospital, you were there to meet him, and I'm guessing you walked, or either you walked with him or he encountered you at some point and he heard your voice. You were probably telling him.
Yeah, at that point, I don't remember that, but yeah, I was there to, see him, admit him, and take him to his first surgery, which was to get a tracheostomy.
And you were probably saying, we're going to take care of you.
Yeah.
It's going to be okay. And he couldn't see because his face was shattered. He couldn't see, but he heard you say, "It's going to be okay. We're going to take care of you. We're going to make it's going to be okay." And then, okay, I'll let you pick up the story now. So he came back for a follow-up appointment several weeks later.
Yeah, this was weeks, maybe even months. It took him a while to heal, but I think he came to get his arch bars off, maybe. I guess that's when he told me, he said, I don't remember much from the accident, but he said, I remember hearing your voice. Mm. And that gave me enough hope to hang in there. And I couldn't see anything, but just hearing that kind of got me through.
But he also hugged you, and he said,
he gave me just a huge hug.
Thank you for saving my life.
He said, thank you for saving my life.
Mm.
Yeah, it's a good story.
It's a great story. It's a great story.
Yeah.
It is incredibly sacred and meaningful work to be there. I remember one time that you diagnosed me with epiglottitis, which is what killed George Washington. I always like to tell this story, at dinner parties as well. But Ian is the one that that diagnosed me with that illness, which is really can be really fatal very quickly. and the female doctor, the female attending, because you were actually in residency at that time.
Yeah, I almost blew you off.
Yeah, I know. Well, I wasn't going to say that,
Yeah,
but
well,
you were very busy in clinic. You were very
I had
busy.
charts stacked in the office, and she calls like mid-afternoon, and I got my charts, and then my chief resident threw his charts in my box. Hey, and you mind seeing my patients? I've got to
Sure.
take off early. Anyhow, so yeah, I was swamped.
Yeah, and so I had this horrible sore throat, and he had looked in my throat twice and said, it's nothing, it's viral." But it was like the worst sore throat of my life. And then I started getting that hot potato voice, and that's how I think you heard on the phone.
Yeah.
So I went in, but I tell the stories because I remember the attending's voice there. She was a wonderful surgeon who everybody loved, and she always got so many gifts from her patients. But her voice was so calming. And when you're in a scary time and you're not sure if you're going to make it or not, just to have a calming, reassuring voice is such a huge comfort. Yeah. So I love that story. All right. And then the last story that I always love to tell is actually from, is it from medical school or residency? I call this the story of the half head.
Oh gosh.
Is that from residency or medical school?
That's a gruesome story.
Oh, I know. I love it. Please
we don't
tell
want
it.
to shock.
Oh no, we want to tell that story. It's so great.
Oh goodness. Well, this is medical, not medical. Is it? No, it was residency. Our first year of residency, we had something called temporal bone lab. It wasn't just first year; it was throughout the residency.
Where's the temporal bone? Because I wouldn't know.
Well, temporal bone is like here. It's the ear, contains the ear, and that temporal bone contains the temporal lobe of the brain. Anyhow,
so it's important.
Yeah, well, we use it because we do ear surgery, and the ear anatomy is very, very intricate, and it helps residents to learn ear anatomy better and to operate and do ear surgery. We do mastoidectomies and get in the middle ear, do stapedectomies, and do middle cranial fossa approaches and labyrinthectomy. Anyhow.
Well, and you didn't tell us. I asked you earlier the scope of your practice, and you didn't say, but you also do thyroidectomies, and there's a whole lot of that ENTs do.
Yeah.
Besides just sinus surgery and
tonsils
and
tubes,
ear tubes. Yeah.
Anyhow.
Yeah. You do parotidectomies.
Yeah, you're getting.
I know all these surgeries now.
You're getting off track.
All right, let's go back to the temporal bone. So there's a temporal bone lab. He's a resident, and so they're learning about ear anatomy in the temporal bone lab. And this particular day, they had a real special on tap for the temporal bone lab. What was it?
Well, every now and then we'd get fresh frozen heads, and so that's where we got our temporal bones from. So you have to harvest the temporal bone from the fresh frozen head, and so
so we're picturing a freezer.
Yes,
and we're opening the freezer.
Yeah, this was a weekend. I think we do this on like Saturday, Sunday, whatever. So we all go in, we go to the anatomy lab, and they show us where the fresh frozen heads are in the freezer. They come in a bag.
This is where I quit. You see, he lasted way longer than me. This is a point where I would have just said, okay, guys, this has been great. I'm going to go, I don't know, start a publishing company or something, but go ahead.
Yeah, so you take the head out of the bag, and you have a bandsaw,
But you said that these were fresh, frozen heads. Does that mean that they smelled worse than any other?
No, they were frozen.
They're frozen.
Yeah.
Okay, so
no smell.
No, okay, thank you. All right.
Yeah, it's not like formaldehyde. They're not.
Oh, they're not preserved.
They're not preserved yet. So yeah, they're just frozen.
Okay.
Anyhow, so yeah, you have to just get to the temporal bone here. So I think actually they were already cut in a certain way, and so we just had to get the temporal bone out. And again, the only way to do that is like put it on a bandsaw.
So it's just a head. It's just like it's a head. It's just a head.
Yeah, the head.
It's a full head.
And maybe it was the face. I think the brains had already been harvested.
Oh, great. So it's a head without a brain.
Yeah.
Okay, perfect.
And yeah. Anyhow, yeah, so you got to get the temporal bone. That was our goal that day, is to harvest the temporal bone.
Get the temporal bone.
Yeah, so we're doing that. There's a group of us working, and I remember this. We got to this one face head, and we're putting it through the bandsaw.
Well, time out. I need you to tell us about the head first, because this is part of the story you can't miss. This particular head was he was a gnarly dude. Tell us about him.
Gnarly.
Yeah, you said he had a big beard.
He just had a beard.
No, you always said he looked like a Viking or something. Did you exaggerate?
No, I mean, yeah, it looked like a Viking, I guess.
In my mind, he had like kind of wild hair. He had a beard. I mean, I wanted to see, tell us what he looked like.
Yeah, I mean, just.
Like a motorcycle dude?
Yeah, maybe like a motorcycle dude.
Okay.
Yeah.
All right.
Big head, beard. Yeah.
Big guy.
Yeah.
Okay. Thanks. All right. So then what?
Well, we're trying to get to the temporal bone, and we're putting them through. You make certain cuts in certain directions. We were making a cut down the middle first. So we have the head down, face up, and we're putting it
on the bandsaw.
On the bandsaw. We're putting it through the bandsaw.
So you got to cut it like this?
Well, we did at that time, yes. Yeah. And so this story's getting too long. We put it through the bandsaw, and there's a group of us, and there was a woman in our residency group that she was there as well, and all of a sudden the blade hits, it's coming through, and it hits this area here, and the eye just opens up all of a sudden, and I mean, she literally, like, she lost it. When I say lost, she lost everything in her stomach. She turns around, she grabs a big trash can, and she just starts hurling.
So it just, I mean, to have his head.
We had to finish the job.
To have his head on the bandsaw and have his eye open and look at you.
Yeah.
I see, y'all, that was entertaining, wasn't it? The story of the half head. This is great. It's not really great dinner stories, but maybe after dinner stories. So, there's more, but you'll have to have dinner at our house to hear those. But
oh yeah.
So, Ian, is there anything that you want to wrap up today to just encourage our guests with on this idea of the second part of your life can be better than the first part if you decide to make really big choices that sometimes are hard? Can you give us like a parting encouragement?
Yeah, I mean, there's always, you always have choices in your life, and no one should ever feel trapped in anything they do. And sometimes it's just, there's there can be fear surrounding, big choices or decisions like that. But, I look back now at 2.5 years after making that decision, and it was really one of the best decisions I've ever made in my life. And I'm living life now to what I think is its fullest. I have great work-life balance, and the relationships I've been able to pour into have demonstrated, that yeah, I don't know what I'm trying to say, but it's been good. It's been really good. Your job, a job will always be there. Maybe not in today's economy, we'll see, but there's always a job, and it may not be what you want to do, but relationships are, I just think that's where it's at. You can't take your things with you. You can't, but souls exist for eternity. And I think that's one of our main purposes on this earth is for our souls to pour into other relationships, to represent the heart of God, which is he pours love into everybody. He is love. And if we can't exude that same amount of love to the people that we say we love, or to our friends and extended family, because we're caught up in just working, or trying to pay for a certain lifestyle, I think we're missing the mark. Yeah, I didn't want to end
Well, thanks for making
on
me cry,
such
Doc. I appreciate it.
a note, but
I think it's a great note.
yeah.
And thank you for letting me interview you today. And I honor the choices that you've made, not just as your wife, but as your friend and as someone who's gotten to witness you grow and change. I love what I've seen. And I love that you've made this incredibly courageous choice and that you've poured so much time into our kids and our grandkids and our marriage. I can say that I think you made a great choice.